Integrated care, the concept was based on the Department of Health's three drivers, the three drivers being risk profiling, integrated care teams and self-management.
Good morning, King Medical Centre, can I help you?
My name's Dr. Dagenham. I'm a GP in Barking Dagenham, working in North East London. I'm the GP lead for the King Edward's Medical Group, which is this practice for integrated care. I also sit in the Barking Dagenham Clinical Commissioning Group as the Integrated Care Case Management Lead.
Hello, it's Colin, Community Matron. As a Community Matron, my role involves assessing patients that are deemed to have medical needs. My role is to go to that patient, assess the patient, because what we usually do is we carry on quite a holistic assessment and not just looking at the medical needs of the patient, but also looking at social, financial, physical, mental, and from there, I'll be able to identify which things needs to be done for the patients.
My name is Sue Seaman and I'm a social worker. As a social worker, we would get a referral that would come through what we call an integrated care meeting that's held at doctor's surgeries, where they identify the top percentage of people that have like frequent hospital admissions. Quite most commonly, from my experience, is people with COPD, which is chronic obstructive pulmonary disorder, which is like normally they're on oxygen or have breathing difficulties.
Doreen, how are you feeling today?
I'm feeling alright, thank you.
Feeling good. Any concerns, any problems at all?
No.
Dawn's not got a lot of great deal of movement, so she doesn't have a shower. She has a sit in the shower on the seat in the shower.
Yeah.
And sometimes it's a bit difficult to bathe her.
Dory, I think it might be a good idea if we get an occupational therapist to come out and assess you in the shower to see that it's safe for you to get in and out the shower.
Yeah, I'm alright, thank you.
Yeah, but your husband was saying that he was a bit concerned, so I think it might be a good idea. You don't have to be undressed or anything.
I ain't worried, really fine.
Okay, you could be whatever you want to be, but what we can do, we can just get an occupational therapist to assess, because they might say you might need a rail put there or a different setup because it could be dangerous.
So what we're trying to do is develop a system that is working on preventative care rather than emergency care.
Any middle name?
Jackson, J-U-D-S-O-N.
My name's Trudy Williams. I'm a qualified social worker and I'm a cluster manager. I have 2 qualified social workers and 2 support planners. Whilst we're a cluster, we're also part of integrated care, which includes a care coordinator and a community matron.
Yeah, okay. Are you available tomorrow? I could come and see you tomorrow.
My name's Maddie Maypother and I'm a support planner for Cluster 5.
I suffer with fibromyalgia, chronic fatigue syndrome, which obviously brings on the depression. Always in pain, always. My main care is my son. Well, he's almost 14 years old. I like the independence of direct payment. Very, very good. Because with the agency, you don't know who's going to turn up. And then you have to start all over again, telling them how you like things, what to do. And it's just frustrating, very, very frustrating.
I help out mum with personal care and other things. A normal day probably would be like, she might need help getting out of bed, or she might need me to do shopping out, or because of this service I'm able to go out to activities I could do, so I don't have to worry about mum a lot. And they put the care service so my mum could have like 3 carers. So when I'm not home, she'll be okay. So I'm happy for this. I'm thankful for the service actually.
My name is Jutta Wiese, social worker in integrated care. Yeah, we're sitting together in the same room, in the same office, in order to really get shorthand, quick information about patients, to be able to go out and assess and to put in services.
Hello, Gladys. Oh, hello. Hello.
The other thing that I think in terms of professionals, I think we found a lot more respect for each other. As a GP, I had no clue what social care did, and to an extent it wasn't part of my agenda.
And you said your carers are doing a good job in here.
Oh, very good. All the services. Some I never even knew they existed.
In essence, this team is all about improving communication, simple things that change lives so dramatically.
Maddie started coming in, help, because we used to be told to phone up this number, which we did. Then Maddie's put us on to other people like the rapid response and now the integrated care team, because now I feel that there is someone there when I'm not well rather than being on my own.
Designated social worker, designated, integrated team. We've got a support plan in place. We know who to go to now when we need that support and we need that help. And we know, because of that support plan, we know
something new. Like yesterday for the doctor, as I say, the doctors yesterday, we didn't know. I've gone round there, sat there, waited my turn, gone in, and he said, well, you didn't have to come round. Did you have Colin's number? But the wife had looked at the pack, but obviously didn't realise that we could call him out for that. We thinking it had to be something serious. But he said, no, you can call him out even for a water infection, because he'll tell you if you need to go to hospital or if he just gives you antibiotics and writes you out a prescription for antibiotics. But now I know all that.
We really hit rock bottom, and I mean rock bottom, before we got introduced to Maddie. Like Gerald said before, our marriage was in quite a bad state. The money and the support, it gave me a little bit of a break, and it's now given me and Gerald time as well to be husband and wife more than, so to speak, carer, etc.
Right, okay. And how is your breathing at the moment anyway?
The minute I start doing something, can't carry on because I've got to sit down and get my breath. Since I've known Colin, life's been a lot better. I even can go out now. Yes, I went down the road for a cup of coffee. Not very far, but I went out.
Our meeting in Barking Dagenham is 2 weekly meetings which are in every GP practice across the whole neighbourhood. Each of the care teams come to the practice and discuss the patients that have been identified as having needs, usually identified through a piece of software called Health Analytics. Health Analytics, what it does, it picks up data from hospital as well as the GP data, as well as having input from social care, and via an algorithm gives us an idea of people who are at risk of being in the hospital, i.e. the top 1%.